Good morning, everybody. You just caught me picking up my coffee. Hello, it's Tess Crawley here this morning. It's Monday morning. A little bit overcast and dull today. I'm talking today about a topic that is quite a controversial one and quite a sensitive topic today as well. So I wanted to give a really clear warning and an opportunity for anyone to opt out of listening to this topic in case it might be a bit too sensitive. Good morning, Nat. I can see you've joined me today. Lovely to have you here. I'm just giving a little bit of a heads up and a bit of a warning that today's topic is quite sensitive. So we're talking about self-harm today. Now, before I do all of that, I'm going to be sharing today's vlog into the Stigma Rebellion for those who want to comment in a more private forum. I'm also going to be sharing this into my group for psychology supervisors called Psychology Supervisors Australia. So I'll just do that. In the meantime, as I said, self-harm's a topic that is actually quite controversial. That is a sensitive topic. And some people do find it a bit distressing, even though I'm not going to be talking about anything graphic. Just the concepts themselves can be a bit upsetting to some people. So just keep that in mind before you decide to continue on. Now, I just can't find my live stream. That's a bit sad. Just a minute. I'm on my laptop here trying to get the live stream so I can share that into the other two groups. There we are. Okay, so we'll share that into the Stigma Rebellion. And just a reminder, if you haven't joined the Stigma Rebellion, it's what's called a closed group. But of course, a closed group in Facebook language just means it's that your comments are closed from view to those outside of the group. So if you're looking for a more private, if you like, forum for discussing this topic, you can certainly join the Stigma Rebellion for my future videos as well. And I'm just also going to share this into Psychology Supervisors group because I said I would. And I'm now going to have to try very hard to keep an eye on comments from across the board. So if you do comment, and I don't respond, bear with me. I've still got my L plates on for sharing into multiple groups. Okay, sorry, I've bitten myself. Right, so I've talked about a few topics to do with borderline personality disorder this week. Last week was, or over the last few days, last week was Borderline Personality Disorder Awareness Week. This week is Mental Health Week in a number of states around the country. And I think October is generally Mental Health Awareness Month. In November, coming up, we also have Psychology Week in the early to mid part of November. So there's lots of opportunities for us to talk about some really interesting and challenging topics. If you've not met me before, my name is Tess Crawley. I'm a clinical and forensic psychologist with a psychology practice in Hobart, and we have both psychologists and mental health accredited social workers working with us in Hobart and in Launceston and in rural outreach. And of course we also offer services online, so that if you're outside of Tasmania and you feel that you'd like some support from us, just give us a call to our Hobart office, 6223 2122 03 at the front. Or you can also contact us via our website. I can see Luke's joined us too, in more ways than one. Luke, welcome aboard. And Anna's here too. Oh, good. We've got a little party to talk about a very serious topic. Okay, so I've talked about self-harm in a number of forums over the years. I've mentioned in one of my earlier videos that I used to do a lot of work with borderline personality disorder, and when I was doing my PhD, I did a lot of research around aggression and personality symptoms, personality disorder symptoms in young women, and that also got me speaking publicly about topics to do with self-harm. I've spoken to conferences for coroners on suicide and self-harm. I've talked to conferences on GPs and other psychology conferences and so on. Hi Tamara, thank you for saying hello. So I've talked about this topic quite a bit in public forum, but usually with other professionals in the field. So I'm quite mindful today that not everybody listening, of course, is a professional in the field, that there are some people who just have a genuine interest in the area, and there are also some people who might be watching who might actually have borderline personality disorder. So if I'm talking to you and you've got borderline personality disorder, or you feel that you might have borderline personality disorder, just be mindful that today's topic might be a little bit triggering for you, as I said at the start. If you need some support with that, of course you're welcome to contact my team. But also the websites for Sane Australia and the website for BeyondBlue have some really good contact numbers on there that you can call if you need some support. And of course, don't forget there's the BeyondBlue app called BeyondNow, which is a really good safety planning app for when you feel like you're at risk of self-harm or suicide. So taking this concept really seriously right at the outset, we're talking about self-harm. One of the things that really we need to be very clear on when we're talking about self-harm, and that is the stigma that comes with self-harm. Individuals who engage in self-harming behaviours are often terribly ashamed of their own actions. They feel bad afterwards. They feel embarrassed. They feel ashamed quite deeply. So the stigma that is laid at the feet of those individuals around those topics I've talked about before, about being labelled manipulative and being labelled attention-seeking, we really need to get to the core of understanding that those two labels are not helpful. They're in fact quite harmful. By labelling individuals engaging in self-harm behaviours as manipulative and attention-seeking, what we're doing is we're heaping more shame on people who are already feeling quite challenged by their own behaviours. What we need to understand about self-harm is it's actually a cycle, and it's a cycle that begins with emotional distress and it ends with shame. And when we add more shame, we run the risk of increasing the chances that cycle starts again with emotional distress, and around we go. So what are we talking about? So self-harm and suicide, what's the difference? So the general assumption about self-harming behaviours is that we're talking about behaviours that is usually a self-injury behaviour. Sometimes we're talking about a self-sabotaging behaviour. But typically a self-injury behaviour that is not intended to cause death. Now it's really important that we're clear on that word intention, because self-harming behaviour with the intention to cause death is a suicide attempt. A self-harm behaviour without the intention to cause death can still result in accidental death. So we have to be really clear that when individuals are engaging in self-harm behaviours, they are still at risk of unintentional death. So we need to be really careful that when we're dealing with clients or friends or family members or ourselves, if you're an individual with borderline personality disorder, we have to be really mindful that some of those behaviours can be unintentionally lethal. So we're still talking about a life-threatening condition. Okay, that's really serious, and I take it really seriously, not to be melodramatic. And this is one of the really key aspects to working with individuals with borderline personality disorder, is to avoid the melodrama. So for our clients with borderline personality disorder, there's a lot of chaos, there's a lot of extreme emotions, there's a lot of crises. And for those individuals, their lives feel chaotic enough without us buying into the chaos. So as a helping professional working with individuals who are self-harming, it's really important for us to keep ourselves calm and for us to maintain our own boundaries. So it's really important not to go into rescue mode and try and solve the problems of the world for that individual. Maintain our own boundaries, but support that individual to get the physical help or the medical help that they might need to address the injuries that have been sustained, and then return to the work that we're doing as a professional. So return to the therapy plan. It's easy for, as a psychologist, working with clients with borderline personality disorder and other clients who self-harm, because it's not only BPD clients who self-harm, of course, to get caught up in the self-harming and get distracted by the self-harming, and to lose our focus on what we're trying to achieve in the bigger sense with our clients or those individuals that we're working with. One of the things I often say when I suspect or when I know that a client of mine has been self-harming, one of the things I will talk to them about is about making sure that we've got an honest communication about the topic. And I often say to them, look, I'm not going to be running screaming from the room with my hair in flames if you tell me that you've self-harmed. What we'll do is we'll make sure that you're safe, we'll make sure that your injuries have been attended to, and then we'll focus on what we need to do to reduce the risk of further self-harm. Okay, so it's about managing the situation. It's about being that solid anchor, if as much as you can be. Individuals with borderline personality disorder, as I said before, are surrounded by so much chaos that if we get chaotic as well, then where do they look to for support when they're in that crisis mode, or they're stuck in that self-harm cycle? So for us to be consistent and non-judgmental, really important, non-judgmental, it is so important. I've worked in 2 different prison systems in Australia, and there's a lot of self-harm. I'm sure you can imagine there's a lot of self-harm within the prison settings. And I have been witness to some appalling treatment of individuals who have self-harmed, and with no disrespect intended whatsoever to any colleagues that I've worked with in the past in the prison setting. However, I can see that some of those individuals had little experience in working with self-harming individuals and didn't know how to respond appropriately. So it's always been a bit of a mission of mine to then do as much as I can to educate people about how to respond to self-harm. So what do I do? What do we do in a treatment setting? So with a client, one of the things that's often talked about is self-harm contracts. Now, contracts are tricky little things. It's a piece of paper that you and your client sign together with an agreement that there'll be no self-harm in between sessions. Now, I struggle with these contracts. I see the value in them, but I also see the risk associated with them. I need a coffee now that we're talking about this. Thank you. Self-harming contracts for the right client are a great thing, because what they're doing is they're engaging a conscious act between you and your client, that we both agree that there's a risk that this self-harming behaviour could occur, but let's both agree that I'm going to be here for you non-judgmentally, and you're going to do your level best not to self-harm. And Miles is growling at something out the window. What's the matter there, Miles? And for the right client, that's a great thing. That might be just the leverage they need, or just the little anchor they need to keep them going through that week. Somebody who's caught in crisis mode and is caught in a cycle of distress and despair and not sure where to turn, that contract may not necessarily be enough of a lever for them. And what you run the risk of, and I don't say not to use contracts, but what I do say is just be really careful when you're working with a client with borderline personality disorder to be aware of their whole situation. So don't get distracted just by the self-harm. Oh, hi, Ali, I can see you're with us too this morning. Don't get distracted by the self-harm and at the exclusion of what else is going on in their lives, because I think that we run the risk as helping professionals, we run the risk sometimes of thinking, oh, we've signed the contract, that should be okay now. We have to be really mindful that, number one, the contract doesn't guarantee safety. It's an agreement that you've made in the moment, and we all would hope that that agreement could be stuck to, but it might not be. It might not be able to be stuck to. And then where does that leave the client if they've not been able to stick to that agreement? So if they've self-harmed in between sessions. And remember the role that shame plays in self-harming. So you really need to be really clear with the client that you're working with. Is a contract the right tool to use with this particular client? And for those of you who are sufferers of borderline personality disorder, if you're working with a psychologist or a social worker or any other mental health professional who wants you to sign a contract, it's okay for you to be really clear, for you to say, I'm not sure if I can commit to this. I really want to, like right now, I'm happy to sign it because I really want to commit to this. But can we talk about what happens if I break this agreement? Can we talk about that? Because I think it's really important to understand that sometimes we, with all the best intentions, will sign an agreement like that, thinking that we can commit to it, and then find that we can't. And where does that leave us? So I would hate to think that clients would be afraid to go back to their psychologist or their other mental health professional because they've broken a contract like that and they have self-harmed and they're ashamed or they're embarrassed or they're fearful of getting into trouble. Because of course, you know, your therapist is not going to want that for you. So it's really important to have an open conversation about that if we're discussing self-harm contracts. The other thing, of course, is with younger clients, so teenage clients, those contracts can feel awfully like something they have to do at school. So you want to be very careful about how that comes across and whether or not that's something that's going to affect the rapport that you have together. So whether you're the client and you want to talk to your therapist about how you feel about that, or whether you're the therapist and you want to talk to your client about, you know, is this something that's too much like school? You know, should we be finding some other way? Another thing we do when we're working with clients who engage in self-harm is that we will often look at delay tactics. So we look at some strategies that really appeal to that individual client or the individual person that act as active and successful delay strategies. So in a second I'm going to talk to you about the cycle of self-harm, but understanding that understanding the transience of moods and the transience of thoughts and the transience of impulses and urges is a really key part of this. Understanding that whatever it is I'm feeling right now, if I can sit with it long enough or distract myself away from it long enough, it will pass. And that's a really powerful lesson for self-harming individuals to feel, that they can feel those overwhelming urges, and if they can just find a way of sitting with that long enough, it will pass. So, okay, what is the self-harm cycle? There's been quite a bit of research done around the world on this, and in fact there was some done at the University of Tasmania, probably looking at the 90s, maybe the early 2000s. Yeah, early 2000s. So, you know, there's been quite a bit of research over the last decades about the self-harm cycle, and we understand it as a physiological thing, okay? And this is really important because a lot of people look at self-harm, and especially repeated self-harm, as a behavioural tool. So people are using self-harm to manipulate me, or people are using self-harm to get attention. But if we understand the physiological drivers behind self-harm, we're actually going to go a lot better to understanding A, why people do it more than once, and B, why they find it hard to stop. Okay. We're basically talking about an addiction model here. So we think about individuals with borderline personality disorder. We've talked about how they have difficulty regulating emotions. They have difficulty tolerating distress. Now, at some point or other, that individual may have either deliberately or accidentally or experimentally engaged in one self-harm act. And what they've found is that intense physiological distress that they've been experiencing has eased. Now, for some people it's the sight of blood. For some people it's the experience of physical pain versus emotional pain. For some people it's a sense of being brought back into their own body and feeling real again. So for some people with borderline personality disorder in particular, the distress that triggers that intense desire to escape what they're feeling is relieved by a self-harm act. Now, it's a dangerous act. It's you know, like any addiction, it can take more and more and more to get the same benefit, for want of another word. And this is where the longer self-harm goes on, the higher the risk of accidental death comes into the picture. So you really need to be very clear that if you're engaging in self-harm yourself, that there is an addictive quality to this. There is a risk that over time it will take more to get what you're getting out of it now. So now's the time to get some help with managing the drivers behind the self-harm. Get on board with a psychologist or somebody that you trust who works in this area, who can help you address the early stages. So the cycle starts with emotional distress. The cycle then with the act of self-harming, that distress drops dramatically. So there's like a relief built into this cycle. That's what leads to them wanting to do it again, because it has worked for them on that particular occasion. Over time, what happens is you've got the distress build up, you've got the build up to self-harm, then you've got the harm act itself, you've got the relief that follows on from that. So that's the addictive loop. Then you've got the shame that comes after that, which re-triggers another, or can re-trigger another distress episode, and around you go. So you can see how it's a cycle, and it's quite an addictive cycle. So to give you an illustration of the difference, so the research that was done in Tassie in particular looked at the physiological differences, so heart rate, breathing rate, electrical conductivity within the body, similar sort of measures as what is measured when someone's doing a lie detector test, and looked at the difference in remembered episodes. So obviously they didn't ask people to harm themselves for the experiment, but in the remembered episodes of a deliberate act of self-harm versus an accidental incident of harm. So say you cut yourself shaving. And what they found in accidental harm for people without borderline PD, with accidental harm, you imagine it yourself, you're in the shower and you've cut yourself, okay, and it stings. Your physiological measures or your physiological arousal levels increase because you've hurt yourself, right? And then once you've patched yourself up and realise you're not going to, your leg's not going to fall off, or you haven't cut your ear off, then your arousal levels subside. It's the opposite with borderline personality disordered individuals. With individuals who are addicted to self-harming, it's the opposite. So the physiological arousal rises and gets more and more and more and more intense until the harming act, and then it drops off. So I'm trying to choose my words carefully. I'm sure you can hear that. I'm trying not to use too many graphic images, and I'm trying not to use any language that might encourage the use of self-harm, because I certainly don't want to do that. But I want people to really understand why self-harm happens, why it is maintained, so why people keep doing it, and why it is then, like an addiction model, very hard to stop that cycle without help. So that's not to say people can't. People certainly can, and I've had clients in the past and more recently who have just decided, I'm just not going to do it anymore. And I think that's, an incredibly strong thing to do. Whether it's self-harm or cigarettes or what addiction we might be talking about, just to make that decision and to stop is incredibly tough. And well done to those of you who've been able to achieve that. So then getting back to the distraction I talked about before, so there are a number of strategies that you can use, the basic ones like calling a friend, go for a walk or a run, and we often will look at the physiological component of that self-harm cycle and say, well, how else can we expel that emotional arousal, that physiological arousal? So going for a run, grabbing a punching bag and going hell for leather on that. Anything that gets that burst of energy and that burst of physiological arousal out can help. Might not be the answer for everybody, but it certainly can help for a lot of people. Talking to a friend can help for a lot of people. Singing, loud music, dancing around the house singing, all those crazy things that get you out of yourself, get you out of your own head, and also act as delay measures to get you through that initial self-harming urge to that point where the wave will subside again. Okay, and the more often you're able to do that and get success with that, the better you're going to feel about your capacity to overcome the self-harming addiction. Okay, does anybody have any questions? I should have paused and taken breath before now. I'm sure you can hear it's a topic that I'm quite passionate about in terms of getting information out into the community. I'll just quickly check these groups and make sure that I haven't left anybody's questions unanswered. If you've got a question though, while I'm looking, feel free to pipe up now. Nothing in there. And just checking the supervisors group as well. And nothing in there. You're all listening intently and not asking any questions. I hope that's because I'm making good sense and you're finding it all very interesting. Okay. So, as part of, yep, all good. Okay. Oh, hi Kim, I can see you're here too. As part of our understanding of borderline personality disorder, so we've talked about what it is and how it develops. We've talked about the stigma and the myths around it. We've talked about the treatment, and today we've talked about self-harm. The key message that I've really pushed into the professional community over the years has been that self-harming individuals die by accident too, and self-harming individuals can be suicidal too. So, it's really important to not over-dramatise in our response to individuals when they do self-harm, to be non-judgmental in our approach to working with them through that, and to be accepting of the fact, for us as professionals, we need to sit sometimes with the knowledge that sometimes our clients will self-harm despite our best efforts to help them not do that. And it's not a statement on our abilities as a treating professional, and it's not a statement on our clients' efforts to overcome either. So sometimes those urges are overwhelming. But the message that I really do push into the community is that the stigma around self-harm sometimes will stop us seeing a suicide risk. So when we're talking about someone who habitually self-harms, how do we recognise the suicide risk in that individual? Look for change. So look for something that's out of character. If you know that client really well and seeing something that's different about them, or you're seeing something different about the type of self-harm they're engaging in, if you're seeing an increase in the lethality of the self-harm that they're engaging in, and if you're an individual who is self-harming and you're frightened about the changes in your own thoughts or the changes in your own self-harming behaviours, then do seek help, because we're all here to help you. And there's no judgment. That's really important to understand. We don't judge you for self-harming. We understand where it comes from. We understand why you do it. And we also understand how hard and frightening suicidal thoughts can be. So don't ever be afraid to seek help. It's really important that you do that. So I will put some in the comments section here. I'll put links to the BeyondBlue website. I think in the header post I've put the link to the BeyondNow app. I will also put it in the comment section. I'll put the BeyondBlue website in the comment section and the Sane Australia website in the comment section. There's an organisation in Melbourne called Spectrum that specialises in borderline personality disorder. They have an inpatient facility. A lot of the private hospitals will support individuals with borderline personality disorder. I know that a lot of people with borderline personality disorder have had very difficult times when they present to emergency departments for self-harm. So my mission has always been to keep our clients out of emergency departments, to give them the skills that they need to keep themselves as safe as they can, and to have a range of safety measures in place to keep them less crisis driven and keep them feeling secure in their own understanding of their own behaviours. Pardon me now, I have a frog in my throat. So please do let me know if this has been a helpful topic. If you'd like to know more about this topic also, please let me know. And don't forget to let me know that this has been helpful with a big thumbs up if that's helpful to you. Tomorrow I'll be talking about something a little lighter. I haven't decided what that'll be yet, but it'll be on a completely different topic. I hope your Monday is panning out well for you all. Don't forget that we're recruiting at the moment, so I've got a position in Launceston for a full-time provisional psychologist, 5-year minimum training please, so either a 5+1 student ready to take on the internship year, or a 6-year master's student please. Hi, Robert. You did come in late. I'm just about to, I'm wrapping up now, but do watch again later. There's a lot of information in this one. I'm also recruiting for a principal psychologist to join me and to support me in the growth that we're undertaking as a statewide practice now. Have a look at our YouTube channel if you want to catch up on some of the previous posts, previous videos, and I look forward to seeing you all again really soon. Take care for your Monday. Bye-bye for now.